customized hair transplant plans and designs. Experience a transplant that's made to fit you. We cater to each patient with bespoke hair transplant plans and artistic designs. I'm Dr. Sreedhar. I've been specializing in hair transplants for over 19 years, helping people regain their confidence through natural looking results. Our approach focuses on tailor-made hair transplant designs and plans to match individual needs. Every patient receives a uniquely crafted hair transplant designs and plans for most natural results. How does our hair transplantation plan and design will affect your final results? All of we think about usually hair transplantation results means it may depends on luck, or it may depends on only number of the grafts, whatever it is, but actually not. Basically, how your surgeon is going to design a best design for you, how he's going to tailor-made plan is going to do for you, and how he wisely is going to use your graft, that really makes sense to achieve best results. To explain more about that, I made this video. Kindly watch this video until end to understand what are the factors that influence your final outcome. Usually, each patient's head shape and pattern of baldness is unique, requires a personalized and customized plans to get and achieve the best results. For example, hairline design and placement for class 2 baldness varies with the class 5, class 6 baldness, because most of the times we need to calculate the demand and supply of the hair grafts. Accordingly, we'll design the hairline, number one point. Number two is patient age also matters. We should never try to get their younger look back, because always we lose more hair with the age. So with the age, our newly created hairline is supposed to look natural and should match the needs. That's the one thing we have to think about while placing the hairline. And basically, most of the clinicians and doctors, they implant most of the grafts in the temple angles and waste the grafts even class 6, class 1 baldness, which doesn't make any sense, because that angles, temple angles or frontal hairline would need more number of grafts, where you don't get enough grafts in the mid-scalp or crown. You end up in having a kind of a bunch of implants done only in the frontal area, and backside is completely baldness left. That looks like a weird plan. So these are the things one should be taken care while doing the transplantation designs. There are a few patients with class 6 baldness or class 7 baldness. We always maintain higher hairline because there's a less supply, more demand of the grafts. To balance that, we need to reduce or conserve the grafts. We need to reduce the baldness area by marking little higher hairline, and there's no point of implanting in temple angles. All these designs to conserve the grafts for the mid-scalp or for the crown, so that whatever the area you're going to implant it, you're going to get a reasonably good density, above threshold density, which mimics like having 100% density, which will give you a natural looking transplantation. Otherwise, you will have a kind of island shape of hairline in the front and there is no hair in the back, or you got to get island shape of implants in the vertex area and front side there is no hair. All this would definitely look weird and that doesn't give you any natural look. In few patients sharing baldness front and crown area, we usually implant in the front and mid scalp at the priority basis, because that is the area which is going to change your appearance by 90%. When it comes to the crown, only 10% change you get with implantation in the first time there. So usually we need to focus first time to restore the patient confidence back. So front and mid scalp area, that's the reason we're going to focus there. Usually crown portion will implant in second session or second day. So because when someone sees in the front, the visual appearance would be changed only with frontal and mid-scalp implantation. And that is the priority area one should think about when you design the hairline or mid-scalp crown area. Few designs varies depending on the type of the grafts that you're going to select. In the sense, you're going to use a combination of both scalp and beard grafts. Better not to use this beard grafts in the frontal area and even in the crown area, because front side we need a very smooth hair, should look like a transition zone and very natural looking. So we cannot use the beard grafts. So scalp wig grafts are going to be used for the hairline, and for the crown also we're going to use a kind of a scalp grafts only to get that swirl appearance natural way. Somewhere in the mid scalp, a combination of beard and scalp can be used, or beard alone can be used. That's the priority. Otherwise, most of the people think that why can't I go with the beard first and later scalp? That's the reason we cannot do beard grafts first time. So usually we need to either it should combine with the scalp grafts in the implantation, or maybe you can use the mid scalp area without having a kind of a difference looking. Otherwise, beard grafts looks a little thicker, coarse in nature, and even curly. So those cannot be used for the frontal hairline or even in the crown. And these are the kind of design changes will applicable to this when you choose for combination of the grafts. So this is another point to be noted when you think about designs and the natural plans for the hair transplant. So what are the few other factors that we need to consider about before designing and planning a hair transplant would be, what are the facial thirds that we are going to calculate? Some people have the forehead is bigger, some guys has forehead is bigger but chin is smaller. Usually a forehead counterbalance the chin. In such scenarios, we cannot take forehead smaller because you become a kind of a very chubby face or funny facial profile. So we have to calculate all those things, number one. Number two is kind of what kind of hairstyle patient is going to follow. Is it neutral hairstyle, or is it going to brush it back, or is it going to comb it left side, right side? What are the natural angulations that he has right now? All those things definitely should be considered before making the hairline design, even in the implantation. And apart from this, what are the kind of hair texture? At times we have a coarse hair, curly hair, silky hair, straight hair. Straight hair people definitely is difficult to achieve density in single session. All these are really matters. Accordingly, we need to reduce the baldness so the density of the implantation would be above threshold density to give you illusion that you're going to get a natural density. This uniqueness, craftedness varies with person to person, and because even though baldness remains same class 5 for 2 to 3 individuals, the plan for each person definitely varies. So for that, you can consult your expert doctor and take opinion on that, and you can ask for the markings that what you're going to do. Most of the people think that these markings may not be good because they don't know how it would appear after 8 months. Kindly think about this. This marking wouldn't make any sense to you, but when we implant it in a natural manner, after 8 months, how would this marking implantation would ends up in kind of a density or naturalness? Only your surgeon will know. So you need to interact with your surgeon and discuss with your doctor about all these plans and goals, then arrive at a better plan and designs which can give you a better and natural density and natural looking transplantation. Because in transplantation, only having hair doesn't make any sense. It should be having no attention to it. Kind of natural looking hair has to be there to give you illusion that you are not bald or you are not even done a transplantation. That's the whole picture of the transplantation designs and plans. Thank you.